Hello everyone, my name is Brad Capawana. I'm a podiatrist. Podiatrist is a specialist in foot problems, and I've been here in Lapwai and working at Nimiipuu Health now since 2007, so quite a while. Our communications department here at the clinic has reached out to the community for some questions that you'd like to have answered, and so I think what I'll do is read the question and then do my best to give you an honest answer. The first question: does lacing your shoes a certain way help your feet not feel so tired after standing for long hours? And I would say I'm not familiar with any lacing patterns making a difference in terms of foot pain. However, people that stand for their work or hobbies and things like that, and the calf muscles are not contracting and squeezing the fluids and blood in and out of the feet, then you will get some swelling, and that swelling can create pressure inside your shoe that can cause pain. So we've all gone home after a long day of being on our feet and taken our shoes off and felt a lot of relief. So maybe loosening the shoe or wearing a shoe with some more arch support or more stability through the midsole would be a good option. The second question is arch and foot pain related to diabetes. And yes, burning pain associated with diabetes is pretty common actually. It can be treated with certain medications. Obviously, it could be mitigated or slowed or somewhat prevented with good blood sugar management. Sometimes with the burning pain, we have kind of a tier of treatment. The first things we start off with are things that counter irritate the burning. So things like Icy Hot or Tiger Balm or Absorbine Junior. Those things work best at night with maybe some counter pressure from socks. Then we move up to things like tricyclic antidepressant type drugs like gabapentin. I have a lot of diabetic patients that are using gabapentin, and that allows them to sleep through the night and gives them a lot of relief. So arch pain, no, it's not related only to diabetes. People can have arch pain and foot pain from stress through the foot. And again, I like good arch support, stable shoes, and then not standing in one place. I think that is really hard on your feet. The third question is, and I'm not a diabetic, but I'm a female in my 40s. When I get out of bed in the morning, I get a sharp shooting pain that feels like lightning or pins and needles through the arch of the foot. This patient was seen and given gabapentin for that pain. So anytime someone talks about a burning pain or a tingling pain or a shooting pain, I start thinking about nerve pain. And where could that come from? Well, you can have localized nerve entrapments. That would be like a tarsal tunnel syndrome. You can also have nerve entrapments or problems with your lower back. Your lower back, the nerves L4, L5, S1 area of your low back, those nerves leave the spine and go down your legs and innervate the arch and the heel of the foot. And that could be causing that pins and needles feeling in your foot. So if you have that, I think that's something that you should probably have looked at by a specialist or by your physician. And then, hopefully the right diagnosis can be made and the right treatment can be instituted. The fourth question today is, do you perform the Lapiplasty 3D bunion procedure? I performed the original procedure. The Lapiplasty is kind of a take or a modification to the original procedure called a lapidus. A lapidus is a fusion in the middle of the foot, but it also corrects the bunion, and it corrects it in 3 different planes, and that's why it's called a 3D procedure. The Lapiplasty, however, has some different plate systems that they use to fixate the fusion site, and it also has a little jig where you can cut the joint. But I think all of these things can be done without necessarily using the Lapiplasty system. The Lapiplasty system can be expensive, and the Lapidus procedure, when it's indicated, is a really good procedure for correcting the hallux valgus deformity. The fifth question is about pedicures and diabetes. And I always answer my patients this way. Yeah, you can have pedicures and be diabetic. However, it's important that you measure the risks with the complications. The more risk factors that you have for foot problems like numbness in your feet or poor blood flow in your feet or a lot of deformity or thick abnormal toenails, those things make you more at risk for having a complication with your pedicure treatment. If you're going to have a pedicure, I'd make sure that they're a licensed professional, that they use clean instruments, if not sterile instruments, to perform that procedure. So, if you don't have any of the complications associated with diabetes, like numbness and the things that I mentioned earlier, I think it would be okay to have, a pedicure. One of the most important things that I tell all of my diabetic patients is to check your feet at night before you go to bed. If you've been to the pedicurist and somehow you start having foot pain later in the day, make sure that it's not red or it's not draining or it's not, painful. If it is, then you need to get in to see somebody right away. Sitting on those infections is not a good habit. The fifth question has a second part to it. Is it safe to take care of my ingrown toenails? And again, I would say if you're diabetic and you have ingrown toenails, if they're red and they're hot and they're swollen and things like that, I would not do anything with those. Go see your physician or come see me here at Nimiipuu Health. The sixth question is, how do I get an appointment with you? And let me just give you the phone number to the clinic. It's 208-843-2271. And one of our patient care coordinators will help you get scheduled for an appointment. Again, that phone number is 208-843-2271. If you have recurrent corns and ingrowing toenails, will corrective shoes help? And the second part of that question is, if I need corrective shoes, will I get the molds done at Nimiipuu, or do I need a referral? So for corns and calluses, first of all, a corn is a callus, and a corn is also a callus on the top of the toe. Corrective shoes could possibly help that. But basically, it's just a pressure problem, and so getting a shoe with a deeper toe box or a wider profile might help you with that. We do participate in the diabetic therapeutic shoe program, and you would need to get a referral from your physician, your primary provider, to go then to OrthoPro in Lewiston, who will take a mold of your foot and then they make custom inlays for the shoes, and then you want to get a shoe that has enough room in the forefoot to help with that. People can have callousing all over the foot from the heel to the toes, and sometimes the shoes will help that problem and sometimes they won't. Sometimes we can make a modification to the diabetic inlay or the insole that's in there so that it helps with the callousing, but a lot of times that just needs to be trimmed, and once you trim that, it's probably something that's going to need to be done on a regular basis. So yes, shoes can help, but it's going to be an ongoing problem. Do compression socks help with circulation in your feet? Well, let's talk a little bit about circulation, because there's two different kinds. There's circulation from your heart, pushing blood down to your toes, and then there's circulation that brings the blood back up out of your feet into the main circulation. The type of circulation that takes blood from your heart down to your toes, we call that arterial blood flow. And your arteries are special blood vessels that can expand and contract based on need, and they are super important in terms of good foot health. People that have atherosclerosis or clogged arteries have poor perfusion or poor blood flow to the foot. In that case, I would be very, very careful with a compression stocking, right? Because you want to make sure that you're getting the maximum amount of blood that you can to your feet. If you're compressing the legs and the feet, that may inhibit that blood flow and could be a problem. If you have swelling or chronic swelling in your feet, that may be from tired veins. Veins have valves that go up like this, and when the blood comes up through there, and then it can stop then at the valve, and then the next contraction of the heart can push that blood up further, kind of like standing on the rungs of a ladder. Over time, those valves can get tired, and then the blood can kind of go back down and then fill the blood vessel, and some of the fluid in the blood then can leach out into the skin or the interstitium, and it can create chronic swelling in the feet. So if you have a venous problem, compression stockings are indicated, and that would be helpful at returning the blood from your feet and getting some of that fluid out of your feet back into the main circulation, and that would be useful to you. But again, those things have to be evaluated. People can have arterial disease that coexists with venous disease, and so you want to be careful and make sure. If you've got good pulses in your feet and your feet are warm and pink and healthy, then I think that you most likely have just venous disease if you have chronic swelling. But chronic swelling can be caused from a number of different things. It can be caused by not enough protein in your blood. Your kidneys may not be working well, your heart may not be squeezing well, you may have problems in your liver. So you want to make sure that if you have chronic swelling that you are seen by your provider. Make sure you identify what the problem is that's causing the swelling. And then if compression stockings are indicated, then he can provide those for you, or she can provide those for you here at the clinic. Our last question is regarding toenails, thick irregular toenails, and how to fix them, or can you fix your own? Well, there's several things that can cause irregularity in the toenail. Sometimes people think that they have a fungal infection in the toenail, when in actuality they've damaged the nail bed. A fungal infection we call onychomycosis. Damaged nail beds we call onychodystrophy. Onychodystrophy and a fungal infection can also coexist. But the problem is that when you have a damaged toenail bed, it's always going to make that same crazy toenail. And so treating that with an antifungal is not going to help. So again, having that looked at, having that, discerned whether or not this is a true fungal infection, or whether this is both, or whether it's not a fungal infection at all, but just a damaged toenail, will be important in treating that. In terms of treating it yourself, I've never seen anything topically applied or the foot soaked that will help a thick fungal toenail. I just haven't. There's lots of, home remedies out there like apple cider vinegar and Vicks Vapor Rub and tea tree oil. I've been doing this now for a little over 30 years, and I've just never seen anybody's bad toenails get better with soaks or topicals if it's a true fungal infection. It needs to be treated either with an oral antifungal, or sometimes you can have the nail removed and a topical antifungal applied to the raw nail bed. Those things do actually help. Well, that's all the questions today. Thank you for letting me participate in this wellness program. If you have any other questions or things that you'd like to talk about, come see me. I'd love to visit with you. Take care.